So next, we have Dr. Amir Hadanny. Dr. Hadanny is the Chief Medical Officer and Head of Research at Aviv Scientific. He's also, luckily enough, a physician at Aviv Clinics here in the Villages. He's a Harvard Research Fellow in the Brain Modulation Lab, and he's published more than 60 scientific studies on the use of a unique hyperbaric oxygen therapy protocol for neural rehab and aging. Welcome, Dr. Hadanny.
You're here because you understand this concept. You've already heard about it at least twice from both Dr. Eric Verdin and Dr. Barzilai. You'll probably hear it a lot, but you notice there's a big difference between lifespan, which is the years we're counting and we're celebrating birthdays since the day we were born. But that's not the important part. The important is health span. It's the amount of time you spend with good quality of living. The amount of time that you don't have disabilities, chronic diseases, and what we call frailty. Simply what some of us will just call not living. You're here in the Villages, a lot of you, because you know this and you chose this to spend your time in the best quality of life. And that's our goal. Our goal is to increase or elongate health span, not lifespan. I think Dr. Eric Verdin made this point that living to 100 without health span is not worth it. And when we think about evolution, why is that? Why we're not supposed to live that long? So evolution didn't plan for us to get that far, right? As mammals, we were brought here, like any other mammal, to reproduce and get the heck out. That's true. That's true. That's what we were made for. But modern medicine has solved so many problems. Think about it. Antibiotics, then heart attacks, now strokes, all the things, and cancers for most. A lot of things that have shortened our life to 30, to 40, to 50, to 60. Think about 100 years ago. So we were not supposed to get to where we are, but we are, because of modern medicine. And when we pass the stage that evolution is planned for us, and we reach that aging phase, there are two phases here. The one we call protective aging, that we live with good health span, but there's a threshold that might come where we switch to the frailty, to the part that we don't have good, healthy living. There are many hallmarks that Dr. Barzilai mentioned some of it. So I'll mention a few of them to let you understand why is it caused, why does it happen. One of them, of the hallmarks, is stem cells decreasing. You can see on the graph that we reach a plateau somewhere in the reproductive years, because again, that's what evolution planned for us, to live through those years. And then as we age, that number and function of stem cells decrease. Stem cells are important to repair. We're at constant building and destroying any organs of our body, and we need stem cells to balance destruction of our organs. So the moment we reach that threshold that we talked about earlier, that's when we switch to frailty and lack of health span. Another process, another hallmark, is something we call senescence cells. Apparently, we have different cells in our body that are important for development, to creating different organs, to creating repair of organs. Some of them actually have been found to be protective from different cancers. But apparently, as we age, as time passes on, again, switching off the phase we were supposed to live at, those cells become non-useful. They don't have a purpose anymore. And they stay in our bloodstream. We call them senescent cells. And apparently, they become toxic. From being productive, they're actually becoming non-productive. Call them senescent cells or dormant cells or zombie cells. and they're actually associated with cancer, with Alzheimer's, with cardiovascular disease. So a lot of companies are trying different medications, like you heard, called senolytics, to try to decrease senescent cells, to target this pathway. Another process that you all know about is atherosclerosis, that accumulation of plaques, cholesterol plaques with a lot of other things going on there that clogging your arteries. If you have a big artery being clogged up in your heart, you have a heart attack. If you have a big artery clogged in your brain, you have a stroke. But what about the small arteries? Apparently, the biggest issue with atherosclerosis is the small vessels, not the large ones that cause heart attack or stroke. We have small arteries, we call arterioles, that are being occluded all the time. All the time in any organs, including our brain, are being occluded every day. We suffer those tiny damages that accumulate, and that's what eventually can lead to the dysfunction of that organ. Here's a good example of what's going in our brain. So this is a German study that followed, let's see if the video working, yep. So this German group followed 75-year-old men that went into an MRI scanner week after week without any symptoms. They were 75 and they went in the MRI week after week. And what you'll notice is those tiny little blips. Here's a couple on week 4. Here's another, week 6, week 7. You see all those tiny blips? That's exactly what I was talking about. Small arterioles, small arteries are being occluded, and we have a tiny damage in our brain. But that happens everywhere in our body. That's the dysfunction that our organs suffer as we age. What can we do about it? So when I studied medicine, they told us it can be done. For the brain, you cannot regenerate it. It doesn't have the capabilities to regenerate. Whatever is gone, live with it. And this was not long ago. This was 20, 22 years ago. Some schools still teach it, maybe. Hope not. This is a work from the Weizmann Institute by Michal Schwartz, showing that it is possible, that an injury to the brain is exactly like an injury to any other part of our body. We can fix it. It can be regenerated. It can be repaired. And the concept of repairing a wound or an injury in the brain is exactly the same as an injury anywhere else. The name of the cells may be different because we name them differently, but the concepts are exactly the same. So now is the time for you to take out your notes and write the recipe of how to repair the brain. That's what you need. It's exactly like making a cake. Number 1, energy. And we're going to review each one of them, exactly which fridge you're going to take it from. Number 1, energy, mostly oxygen. Number 2 is a trigger. Talk about 3 is stem cells, and 4 is the creation of new blood vessels, or what we call angiogenesis. Let's talk about the first one, energy. Apparently, oxygen is the limiting factor for our brain activity. How do we know this? The best example is you guys texting and driving. Please don't, right? The moment you try to text and drive, bam, something happens. Whoa, what happened? Why? Because we don't have enough energy to multitask. That's what happens. And then as we get older, it gets harder and harder. The exception is women, right? They can multitask. They can do everything. They can text and drive. I allow it. But that's the best example that you really need a lot of oxygen in order to do high performance of your brain. Obviously, when you want to repair a wound, when you want to repair an injury, you need even higher than the basic oxygen we're always utilizing. So how can we increase? How can we increase oxygen, right? We're breathing normal oxygen, normal air that contains 21% oxygen. That's the best we can do, right? What we found out, we can increase oxygen to the brain using something we call hyperbaric oxygen chamber. It looks like this, the picture on the right. It's a metal hallway, a metal chamber that you walk in, you sit down, the door is closed, and then we compress it with air to a high pressure, and then we breathe 100% oxygen under that pressure. Why do we need both oxygen and pressure? Because due to physics law, we are able to dissolve much more oxygen to our blood at high pressure. The best way to understand that is a Coca-Cola can. And no, I'm not getting funded by Coca-Cola. Think about that. The Coca-Cola can has carbon dioxide pressurized into the liquid. The moment you open the can, that's CO2 coming out. So when you walk into a hyperbaric chamber, you're a Coca-Cola can, not a Pepsi. So that's the first component of oxygen, and we wanted to check it out. So a couple of years ago, we took several A students from college, and we put them in the hyperbaric chamber, and we gave them dual tasks, like text and driving. So on one hand, they were answering some questionnaires, and on the other hand, they had to do some motor tasks, putting beads into a different cup, and they had to do it together. What we found out, if the chamber is not working, they're not breathing oxygen, they do it in a certain rate, pretty poorly. If we turn it on and they're breathing high pressurized oxygen, they do much better. They are able to text and drive. So that's the first component. The second component, a trigger. We need to tell the brain to start healing itself, to regenerate. In 1995, they found out this trigger called HIF-1 alpha, or hypoxic-induced factor 1 alpha. And this is the factor that's being produced when a cell feels stress. The moment a cell feels stress, it produces this factor, and a lot of regenerating cascades occur. We won't go into all the cascades there, but those are the cascades that create regeneration. Dr. Verdin talked about caloric restriction. Caloric restriction creates stress in order to induce regeneration. This is exactly the same concept. When the cell feels stress, it produces HIF-1 alpha. We found out that if we do repeated exposures, i.e. going every day to a hyperbaric chamber, day after day, we are able to induce HIF-1 alpha. And at 60 times, we're actually peaking the level of HIF-1 alpha. But wait a minute, how am I able to get HIF-1 alpha with high oxygen when it's supposed to be induced with low oxygen, right? Hypoxia is low oxygen. The reason is a concept we introduced called the hyperoxic-hypoxic paradox, getting hypoxia with actually high oxygen. What we're doing in the chamber, we're doing a specific protocol that you breathe pressurized oxygen on and then off, on and off for a certain period of time. What it does, it causes oxygen fluctuations. So you have very high oxygen levels and then normal, high and then normal, never low, but that difference, that delta between high and normal causes the body and the brain to feel stress and induce that trigger of regeneration, that HIF-1 alpha. Hope that's clear. So that's the second component. The third one, stem cells. We talked about them. We start to lose them. And those are the building blocks of any organ in our body. We found out that, again, if we do repeated exposure in that specific protocol, we're able to recruit stem cells and make them work and repair tissues. One type is something called hematopoietic, meaning they're able to create blood cells and blood vessels, that we'll talk in a second. The other one, mesenchymal stem cells, those are the cells that are able to regenerate brain or liver or heart. They can differentiate to anything. And again, we're able to peak after 60 sessions. The last component, the fourth component, angiogenesis, creation of new blood vessels. Think about that. We're trying to repair a dead tissue, an injured tissue. Where would you like to plant a small seed? In the desert or in these flourishing meadows? Right? You have to supply the plant with water, or in our case, the injured tissue with new blood vessels that will supply blood. Otherwise, it will not be successful. Think about what we saw from the German study, all those tiny blips. Unfortunately, if I scan each one of you in the crowd right now in the MRI, that's what I'll find. Those tiny white spots that you saw that the German groups have shown you, because we're creating them every day, every week. Those tiny spots are the injured areas. So again, do I want to repair them in the desert or in the meadow? I have to create new blood vessels as the fourth component. So again, the hyperoxic-hypoxic paradox, we have shown that by doing a specific protocol, I am able to create new blood vessels. This was shown in animals by exposing them to this protocol and then taking biopsies from their brain tissues. And then we tried to do it in humans. The problems I had, most of my participants did not want me to take their brain out. Come on, research people. So what we did MRI. MRI is a scanner, and we did a unique protocol that measures blood flow, how much blood flow gets into each point. What you see on the left side, on the top row, you can see the baseline scan. And then on the middle left row, the second middle, you see much more red regions. What it means, we get more blood flow to a lot of areas. The only way you will get that picture or more blood flow constantly, not just for an instant, is by creating new blood vessels or angiogenesis. So there you go. The four components, we got the recipe done: energy, trigger, stem cells, and angiogenesis. Now the questions, where do we deploy it? What's the perfect injury to use it? So we started off with stroke, which is a classic injury of brain. This is a 62-year-old woman who suffered a stroke on her left side of the brain 14 months before she came to us, and she suffered from aphasia, or the inability to speak, and right side weakness. We analyzed it with our SPECT scan, and we found out why, and we located the areas that were injured, and we are able to repair. Those areas are the speech center and the motor cortex. We put her through the program, enabling those four components that I've discussed, and then on the right side, on the circles you can see, we improve those. The green areas become yellow, not entirely, but most of them, meaning we're repairing injured tissue utilizing those four components. And that translated for that woman to start talking again after 14 months from the stroke and starting to move her right hand. What about the aging brain, right? So stroke is a very specific injury, but we talked about the microstrokes those white spots that we see on anyone's brain after the age of 60, those microstrokes, those small vessels that are being occluded and eventually cause decline in cognitive function. Can we treat that? So we set out and we did a randomized control trial, called it the reverse aging trial, where we targeted patients that were 65 years old. I shouldn't even call them patients because they were healthy. They did not have a stroke, they did not have a traumatic brain injury, no other brain pathology. They were just incredible people over the age of 65. And they went through the program. We induced those 4 components of regeneration. And these are the results. We were able to increase their cognitive function in memory, in attention, in information and processing speed. So that functional decline associated with aging has been reversed. We were able to know exactly which parts of the brain we were able to fix, to repair that tissue. We were able to show we're improving blood flow because we are creating new blood vessels in the brain, and that correlated again with better cognitive function. We even did it in even more advanced cases of aging, which is pathological aging, not healthy aging, what we call mild cognitive impairment, when the pathology in the brain is more advanced than just functional decline. Here, we were able again to increase blood flow by angiogenesis and improve cognitive function. But think about this. I've told you that we have that small vessel disease happening in any organ. So not just the brain. So the 4 components of regeneration occurs everywhere, systematically, if you do them with the protocol, with the right protocol. That's why we're able to see systemic effects. So when we measured the same individuals in the trial, they improved their cardiopulmonary aerobic performance, more than 15%. There's a parameter called VO2 max, or the maximal oxygen consumption, that we know is one of the best predictors for mortality in older age. We were able to improve it. Because again, we regenerated tissue. Where? We correlated it with the blood flow in the heart. We did an MRI, again, they didn't want a biopsy of the heart, again, sorry. So we did an MRI of the heart, and we were able to show that we're increasing the blood flow to the heart. So it's again, we're creating new small blood vessels in the heart for better perfusion that translate to better aerobic function. But not only in the heart, we did MRI of the kidneys, and we showed we were able to repair the kidneys. And of course, the male genitalia. And I'm really hoping for the question, what about the women? We haven't analyzed that yet. But for males, what we saw, we are able to regenerate blood vessels in the genitalia, which are the most important. That's what's basically working there, right? And think about it. Erectile dysfunction is exactly, in a lot of cases, is exactly that with aging. We have small blood vessels that are being occluded, and then it cannot go up. So if you're creating new blood vessels, you're improving function. The other thing that we showed in the study, remember those senescent cells, those zombie cells that shouldn't be there, hanging out in our blood? We're able to show that we were actually decreasing them. So that senescent cell is one of the biomarkers or the hallmarks of aging, and we were able to decrease that number, meaning by utilizing those 4 components of regeneration, we're actually improving the aging process. We're changing the trajectory of aging. Another biomarker that we worked on is telomeres. Telomeres are, in each cell we have the DNA molecules that are wrapped in something we call chromosomes. And at the edge of each chromosome, we have a cap called a telomere. And we know that it shortens with age. Every year that passes, it shortens. Our participants have elongated their telomere lengths by more than 25%. We showed that the skin gets better. The senescent cells are not just in the bloodstream, they're also in the skin, they're in every organ. Again, we're able to remove them. Their numbers decrease significantly. So again, those toxic zombie cells have decreased because of this program. The elastic fibers in the skin got better. So again, utilizing 4 components of regeneration repairs tissue, not just in the brain, systematically. Once we completed this study, we formed Aviv, and we formed the Aviv Medical Program. And this is what we do. We're trying to do neuroregeneration and change the trajectory of aging. The core of our program is that hyperbaric oxygen therapy protocol that I've shared with you, that you wrote the 4 components. And if you do it right, with the right protocol, that's the core of it. But you've heard already from the best of the best what else you need to do. That's why we want better results than our trial. So we incorporate all the other things that you must do. In addition to the core of the protocol, we do physical training because we know that exercise is so important. We do cognitive training in order to stimulate our brain even further to the right areas that we want to target regeneration. We do nutrition coaching because, again, you heard that nutrition is so important. So those 5 pillars that you all took notes from Dr. Verdin are incorporated in this because this is obvious. You must do this. We have to add them in. So the program incorporates all of it in addition to the core that we talked about. So any person that comes to the Aviv Medical Program starts with assessments. We do a lot of evaluations, blood samples, cognitive function, physical function, and scans, like you saw, MRI scans, SPECT scans. And then we go through the treatment. Usually the treatment is 3 months. Why 3 months? Because I showed you, it's data-driven. We know that's when we get the peak results of our stem cells, of our trigger. At the end, we repeat all of our evaluations to make sure that we did change. Obviously, we have the subjective reports, but we also want to see the objective reports of what we change systematically in the brain. But we don't want only the short term. We also follow up after 6 months to make sure these results have sustained long term. To summarize, what I've tried to show you that brain repair and regeneration is possible. If you do it right, if you do the right protocol, it is possible. But not only the brain, aging tissues. If you utilize the right protocol and those 4 components, you're able to create neuroregeneration. Thank you very much.